Hello, everyone, and welcome to Pull Up with Limbs and Things. Tonight is a little different. We have Miss Deshonoe Ishman. She is an RN and she works in Alabama. We met actually at Alabama State University, and tonight she is going to talk about her role as an RN, even though we met in rec therapy. So, tonight I hope that you enjoy hearing what an RN has to share about aging adults. Remember, pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to give you an opportunity to share that information with someone else. Welcome, Miss Ishmael. How are you?
I'm doing well. How are you?
I'm good. So tell us a little bit about yourself, what you do, and then you can go right into your advice.
Okay, well, my name is Deshonoe Ishman, and I am a registered nurse. I work post anesthesia care, but I do have a background in rec therapy where I worked with the geriatric population for about 10 years or whatnot. And today I'm just going to share with you guys some tips on some different health issues that older adults face and some risk factors,
Mhm.
ways to signs and symptoms, and how to. Girl, I'm so nervous. Sorry, Chanel.
Don't be. It's okay.
Oh gosh. Okay,
Signs and
it's just
symptoms and ways that.
signs and
Mhm.
symptoms, risk factors, things of that nature to look for. Some of the diseases that I'm going to discuss is heart disease, cerebral vascular accidents,
Mhm.
diabetes, and one of the most important things is fall prevention for our older adults because that's one of the things that I don't like to see is an older adult having a fall and coming to the hospital with a broken hip.
Yeah.
That's one of the saddest things for me because I know sometimes it takes a while for them to heal and then get back into the flow of things.
Mhm.
So heart disease. So what is heart disease? Heart disease oh Lord, Chanel.
Oh, you got it. What's heart disease? Is that when I have high blood pressure?
Yeah, heart. Yes. All right. So heart
Okay.
disease refers to several types of heart conditions. The most common type of heart disease in the United States is coronary heart disease. You may have seen the initial CAD. This affects the blood flow to the heart, which decreases blood flow to the heart, which can cause a heart attack.
Mhm.
Some risk factors of heart disease is high blood pressure, high cholesterol, and smoking. Some medical conditions and lifestyle choices are diabetes, obesity, unhealthy diet, physical inactivity, and excessive alcohol use. So, what are some symptoms of heart disease? Sometimes heart disease may be a silent killer. That's what a lot of people say. And
Right.
it doesn't get diagnosed until someone actually experiences a heart attack, heart failure, or may have some arrhythmias.
Mhm.
Signs and symptoms of a heart attack is chest pains, shortness of breath. A lot of people describe it as something heavy on their chest, almost like an elephant sitting on their chest.
Right.
They may have some pain or discomfort in their jaw, their neck, arms, or shoulders, and they may experience extreme fatigue, indigestion, and heartburn. In arrhythmias, you may have an irregular heartbeat, something that some people describe it as a fluttery feeling or heart
Mhm.
palpitations.
Okay.
Some people may have heart failure, shortness of breath, fatigue, swelling of the feet, ankles, legs, abdomens, necks, and veins. And the reason why I'm describing these processes because a lot of times we hear heart disease or we hear hypertension and we really don't understand what we're hearing. We just hear heart. So it's understand
Exactly.
to understand the disease process. So when we experience these things, or if someone we know experience these things, that we are able to at least identify that something is really going on with this, with yourself or your family member.
Right. So let me ask you a question.
So,
Someone who
mhm,
has swelling in their feet consistently, long time, long standing, and they consistently also have high blood pressure, they have a combination
mhm,
of these symptoms that you described. Is that a
mhm.
reason for them to go to the ER or for them to call their doctor? What's the best course of action?
I would say if you're not having any chest pains, fatigue, nausea, if you're having those symptoms that you just described, I would say go to your healthcare provider
Okay.
first. I would say go to your healthcare provider first because it is serious, but it's not as urgent as
Hmm.
having the chest pain, the pain part. of it. But if you're definitely having shortness of breath, swelling in your feet, difficulty sleeping at night, go to your healthcare provider. However, if you start having those chest pains, shoulder pains, jaw pain, go to your nearest emergency room.
Okay, that's a good advice right there.
Yes. How to prevent heart disease, we say healthy lifestyle choices. Making sure we eating healthy foods, making sure we're not drinking all the sodas and the sugary juices,
Hmm.
maintaining a healthy weight, engaging in physical activity. Now, for our older adults, I know you can walk in your neighborhood. You can go
Hmm.
to the YMCA. The YMCA has an excellent Silver Sneakers program for our older population. Local community center. A lot of community centers, I know here where I live, have a center specifically for older adults where they can come and do swimming. They can work it out in the gym, and they have a physical, not physical therapy, but a personal trainer there to assist them in their workout programs.
Hmm.
And once again, no smoking. All right. So one of the things that, as a nurse, that I feel like a lot of us lack of, and I think that's very important, that we should make sure we check our cholesterol, manage our blood pressure,
Hmm.
manage if you are diabetic, because a lot of our older adults are diabetics. We need to make sure we properly managing our diabetes, taking our medication as directed, and make sure you're working with your healthcare provider. When I say take medication as directed, I want to specifically talk to our males, because a lot of times when we take blood pressure medicine, it causes other impotence. We'll say that.
Hmm.
And when those things happen, a lot of our guys stop taking their medication. So don't stop taking your meds. Just go to your doctor and let them know this is what's going on, and maybe they can make some adjustments. Okay.
Hmm.
When it
I have a
comes to your blood,
question for you.
yeah.
A lot of people think they're managing their diabetes through their diet, but not checking their glucose levels, or they check
Um,
their glucose levels and they find that, okay, if it says this number, then I'm okay. If it says this other number, then I got a problem. So what's the right number?
the best thing to do is to consult with your physician,
Hmm.
because you may have other health conditions that may require your blood sugar to be in a certain range. So
Hmm.
there's no specific range for one individual. So that's why it's important that you stick with your healthcare team, figure out what your range is, and stick within that range. Just make sure you're checking your blood sugars before you eat your meal and 1 to 2 hours after your meal, and making sure you document that. And then, say, for instance, if you have like a sugar spike, is higher than what it normally is, then you want to document, okay, what did you eat
Hmm.
before then, or what did you do differently, so you can keep track of those things.
Hmm. Now I see a lot of people in their homes, and they tend to not eat throughout the day. They'll eat breakfast, and then they'll wait till later in the day to eat possibly dinner, and not really having a snack in between. And some of that is due to not having someone to make it for you, or feeling like, oh, that's just too much work, or pain that's limiting you from moving around. So I always suggest that you have a snack in between your meals, especially if you're not one that wants to eat a lunch meal, like 3 meals
Right,
a day just isn't your thing. And
right,
having something continuously in your system so that your metabolism is still working.
right. And that's why we it's very important to stay in contact with your healthcare team, because they're
Hmm.
going to teach you these things, they're going to monitor these things, they're going to ask you the right questions. And like you said, if you are a person that doesn't eat like me, I don't eat breakfast. So I know around 11 o'clock, I need a snack. So I
Hmm.
will have my snack in my drawer to eat, because I know at that point, I know my blood sugar levels will start dropping.
Hmm.
But yeah, you definitely keep a snack on you at all times. I just believe that diabetics should keep a snack on them at all times. If
Absolutely.
it's just some peanuts, um, a granola bar, anything of that nature, just make sure you always have something, apple or anything like that. Yeah.
Hmm.
All righty. So we're going to move on to strokes, also known as cerebrovascular accidents. A stroke sometimes is called a brain attack. It occurs when something blocks the blood supply to part of the brain, or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. So a stroke can cause lasting brain damage, long-term disability, or even death. So we have three types of strokes, and it's important for us to, like I said, to know the different types. We have the ischemic stroke, the hemorrhagic stroke, and then we have the TIAs. And it's important for us to know the different signs and symptoms of a stroke, because strokes you have to seek immediate care for. Now, the
Okay.
ischemic stroke is just basically like a blockage or a clot that's in the brain. A hemorrhage is basically the rupture of a blood vessel in the brain. And a TIA is basically where you ever heard of a mini stroke? That's what they
Yes.
call them, the
Mhm.
mini stroke. And basically, they mimics a ischemic stroke. So and I think the symptoms only last for maybe 1 or 2 hours. But
Right.
either way, you still want to seek medical attention with those. All right, risk factors of the strokes is same thing. Health conditions such as high blood pressure, high cholesterol, heart disease, and diabetes. All of
Hmm.
these conditions go hand in hand, and we have to make sure we eat in a healthy diet that consists of healthy fats, things of that nature. We have to make sure that we're getting enough physical activity, not drinking too much alcohol, and not smoking. And we need to understand too that the older we get, the more likely um, the possibility of stroke increases. According to study, a chance of having a stroke doubles every 10 years after the age of 55 years. So that's why it's important that we take care of ourselves.
Say that one more time. It
Uh,
doubled
it
after
doubles
55.
after the age of 55.
Mm.
Yeah. And
Okay.
strokes is more common in women than men. And it occurs more in African Americans, Hispanics, American Indians, and Native Americans. Okay.
Mhm.
Moving right along. So one of the things that I want you to know as a nurse is to how to act fast if you are having a stroke or witness someone having a stroke. I don't lost my little slide here. Hold on. So act fast is an acronym that we use in the healthcare field, and this
Mhm.
FAST stands for face, arm, speech, and time. All right. So if a person's face starts to droop to the side, that's a sign of a stroke. If you ask a person to hold out their arms, and let me see if I can demonstrate it, and it's not balanced,
Right.
that's a weakness, and that's a sign of a stroke. If you
Hmm.
ask a person to repeat a sentence and they have difficulty speaking, that's a sign of a stroke. So time is very critical in that, and you need to call 911 immediately. Okay. And if you are aware of the time, make sure you are aware of the time that you recognize these symptoms, because your treatment will be based on how long these symptoms last. Okay. Any questions?
Yeah.
All right. Another one is living with diabetes. Diabetes is complicated, and it takes practice to manage it in your everyday life. You may be wondering about eating a balanced meal or engaging in safe physical activity, checking your blood sugars, like we talked about before, and giving
Hmm.
yourself injectable medications. So they have a program. Well, there's a program. It's called the. I'm make sure I got it up here. The Diabetic Self Management Education and Support. So if you need support in education, then you
Hmm.
can consult with your healthcare provider, and they can recommend you to a diabetic educator. Okay. Um, if you prefer, you can also go to the Association of Diabetes of Care and Education Specialists or the American Diabetes Association to find a program within your community. And basically, this program will help you teach you how to use your glucometer, when and
Hmm.
how to check your blood sugars, and things of that nature. And I know a lot of people may be concerned about if the insurance cover it, and most insurance covers diabetic education. And if you are on Medicaid covers up at least 10 hours of their education. Okay.
Hmm.
A lot of people go to the doctor and they don't know what to ask their doctor when it comes to their diabetes. So one of the things is you want to ask them, what is your target blood sugar? That's what we talked about before. You want to know what
Right.
your target blood sugar range is so you can know what to look for when you're checking your blood sugars. You want to know how
Mm-hmm.
often you should check your blood sugars because some people may have to check their blood sugars first thing in the morning or at night, depending on if you have type 1, type 2, and if you have other medical issues. And then you want to
Mm-hmm.
understand what those numbers mean. Like if my blood sugar is 60, what does that mean? What am I supposed to do if there's anything that I need to do? If my blood sugar is 500, what am I supposed to do? So you need to understand
Yeah.
what those numbers mean. It's very important. Are there patterns that I show I need to change in your treatment that you may can't have that Snicker bar or that sugar-free cookie that you long for? So you may have to make some adjustments in your diet, and that's why it's important to manage those blood sugars. Um, let's see what else we need to talk about. Blood sugar monitoring. I know a lot of older adults, because my grandmother, she was a diabetic, and I had to do a lot of educating for her and checking
Mm.
her blood sugar and teaching her how to use that blood sugar meter. And one of the
Okay.
things, so I'm going to share a couple of tips with you. First thing you want to do is make sure you wash your hands because we don't want any bacteria getting to that puncture that you're going to give yourself to check your blood sugars. You want to make sure that your meter is clean and ready to use. You want, after removing your test strips, you want to make sure you close that container immediately because they can become damaged if they become too moist. You want to make sure you massage your finger. I'm just going to put my finger in the camera. Massage that
Yeah.
finger really good, okay, because you want to warm it up. What else? Oh, they say do not use the alcohol because it dries the skin too much. So you just want to wash your hands with soap and water, warm it up real good, and give yourself a good puncture. Okay. Then when you squeeze your finger, you want to squeeze from the base of your hand to push up the blood, and then put it on the lancet. And then make sure after you check your blood sugar, you dispose of everything properly. All right. And another thing I want to talk about is 8 steps to fall proofing your home. Like we talked
Mm.
about before, one of the things that we don't want our lovely elderly to do is to fall.
Mm-hmm.
First thing you want to do is check your front steps. You want to make sure there's no cracks in your front steps. You want to make sure that everything is those steps are even. You want to check for lighting in your front door, especially during nighttime. It's good to have those
Mm-hmm.
walk-up lights where the lights automatically come on, or especially when you're coming home late. You want to consider instilling a grab bar, at your stairs. You may have to have a grab bar at your stairs. For your kitchen, you want to make sure your most commonly used items are within reach. You want to replace scatter area rubs with rubber back rubs. We don't want those little rubs that they're going to slide across the floor. Lord
Yeah.
knows I need to find something to hold my rubs down because I thought I was about to go slide myself. But
See? Yeah.
so it's important.
Mm-hmm.
Um, Clean up your spills immediately because we don't want to fall on any water. And if you have stairs, you want to make sure that your stairs are free from clutter. You want to add strips of contrast color to help visualize your stairs, especially for our older adults that have visual impairment. The color tape you want to put it at the edge of your stairs so that make sure you have a clear view. So when you're stepping up, you know that you're stepping up on the next stair.
Mm-hmm.
You can also try lighting at the top and bottom. You want to make sure at the bottom of the stairs you have a light switch, and at the top of the stairs you have a light switch. You want to make sure you have a clear path going up those stairs. And some stairs have one handrail, so you want to make sure, if you can, you can possibly add a second side rail, so that you can balance yourself properly going up those stairs. You
Mm-hmm.
want to make sure that the light is near your bed when you're going to bed. So if you have to get up and use the restroom, you can just turn your light on and you can just walk out. And you want to make sure that the path from your bedroom to the bathroom is clear as well. You have a cell phone, you want to make sure that your cell phone is close to the bed. In your bathroom, you want to make sure that you have on non-slippery rubber mats, and you want to have non-slippery rubber mats in your tub. And you also want to install grab bars by the toilet and tub if needed. May consider a shower chair and a handheld shower head. I have one. It works wonders. And you
It
may want
does.
to install a walk-in bathtub.
Mm-hmm.
So these are my tips and things that I wish that older adults knew. Um, And thanks for listening.
Absolutely. That was very comprehensive. I think it's so important to go from your, especially with the fall prevention techniques, going from outside to inside, because a lot of us think that it's only in the house, but you got to get
Right.
inside. So it's
Exactly.
another thing here too. A lot of people have porches. And so those porches, you don't just want to look at the floor, you want to look up at the ceiling as well. There are a lot of people that I see where, you've been in your house for a long time, and sometimes things have wear and tear. And so,
Yeah.
every so often, you just got to check and make sure nothing's going to fall on you, and then you're not going to step on anything that can cause you to have an injury either. So,
Right.
thank you very much for all of those tips. I have a question because there are so many people I see, and they, you know what they say?
But
I'm not going to the hospital because every time I go, they're going to keep me. Why is that?
I'm not sure why older does. I think with older adults, they're so comfortable with being at home. And
Yes.
I think being away from home, it takes them out of their element. And I think they strive for their independence and they want to remain independent. I think being in the hospital, I think they feel like their independence is being taken away. And I'm pretty sure they don't want to hear anything else about another condition, or I have another health condition or something else that I have to worry about. But I
Hmm.
think that's the main thing. I think more for them is more of their independence.
So I have some that are in their like late 80s, early 90s, mid 90s, and they say, whenever I go, I got to stay. Is there anything that is like an age range that says, okay, if you're this age, we just need to observe you overnight? I guess
Yeah.
I'm sure it depends on whatever, condition they
Yeah,
come in.
it just depends on their reasoning for coming in. If they have to be observed, it can be if they, for instance, if they had a fall, we definitely have to
Hmm.
observe you to figure out. We have to run tests to see why this fall occurred. Um,
Yes.
like we talked about heart disease, it could be you know some heart disease going on there, and we
Hmm.
have to rule out why you had that fall before you leave the hospital. And it could be
Yes.
medication related as well. So we have to figure out what type of medications you on. So basically, I do a full workup from medications to different types of labs. And we're going to be asking you a lot of questions. It could be something that you ate,
Yes.
things of that nature to kind of figure out what's going on with you.
That's true. Okay,
Yeah.
so let's talk vitals, because there are a lot of people who say like they'll leave the hospital and the hospital will say, well, you were on supplemental oxygen or you were using oxygen when you were there. They come home, they have an oxygen machine, they don't use it anymore. And then I come in and I'm like, so we have this machine, we're not using it. Why? And
Right.
then we do exercise. We find that okay, your O2 saturations are decreasing whenever we are doing activity, or we check it and see that okay, we can't do activity at all because it's already too low. What's a good range for people to know in terms of blood pressure, heart rate, and oxygen saturation?
Okay. So for blood pressure, we all know that the perfect blood pressure is 120 over 80. And
Mm-hmm.
then when you're talking about pre-hypertension, you go into like your 130s. That's your top number, which is your systolic blood pressure. And then when you're talking about having a low blood pressure, that's 90. Your top number, your systolic, is having low blood pressure. So the normal range for blood pressure is 120 over 80. As far as your O2 saturations, we want you to be 92% or above. 92% or above. That's O2. If you're anything below 90, see a healthcare professional.
Mm-hmm. What's
Mhm.
wrong? What's going on?
Something's going on with those lungs.
Mm-hmm.
you're
Exactly.
not you're not getting enough oxygen, and you're not getting enough oxygen to your organs. And if you're not getting enough oxygen to your organs, then some things may start not to work properly. Your brain needs oxygen to function, your heart needs oxygen to function, your kidneys need oxygen to function, and you need at least 92% of that to keep them functioning properly. So you want to make sure that if you're supposed to be on oxygen, stay on your oxygen and ensuring that your O2 saturation is 92 above, because your brain, your kidneys, your heart cannot function without oxygen. Okay.
Mm-hmm. And heart rate.
Oh, heart rate, 60. Well, you can say 60 and above. But if you are a person, because some people normal heart rate could be in the 50s, but it just
Right.
depends on their health, on their
Activity level.
yeah, activity level.
Mhm.
So if you a person who have trained for a long time, you're athletic and things of that nature, yeah, you may have a low heart rate. But if you're a person that's kind of sedentary, like activity, then your heart rate should range between 60 to 90 beats a minute.
Okay.
Hmm.
Good. Okay. Now, some people go to the doctor and they get a nurse practitioner, and they
Hmm.
feel like, well, why did I get the doctor? Can you tell us like the differences in nursing levels so that we'll all be clear on if you see a physician versus seeing your MP, what that means?
A nurse practitioner and seeing an MD, that basically the same. They got the same. Honestly, they have the same credentials. Think about this: as nurses, yes, we receive orders from doctors. Okay, but a
Hmm.
lot of times, the doctors actually consult with us about certain things because they know that we are experienced professionals. We work directly with the patients. We There's a lot that we have to do for the patients as far as our nursing tasks and things of that nature. But as far as a nurse practitioner, they have the same credentials as a medical doctor. It's not much of a difference, to be honest. I don't know what else to say, but a lot of times doctors do reference us for a lot of the patient care.
Okay. All right. And then what about if someone is in their house and they need like a nurse to come in to help them out? What level of nursing care should they seek?
Oh, you can do home health care.
Mm-hmm.
Just depending on what type of service you're looking for. For example, if you some people may need someone to come in and help with wound care.
Mm-hmm.
So you registered nurse, BSN, ASN, registered nurse, masters, MSN nursing. They can all come in and provide their wound care service and education for you. It just depends on the type of service. Home
And
health
then
service.
okay. So if there's like an aid, say a person doesn't need necessarily skilled care, but they just need
Mhm.
someone to assist them with like activities of daily living, what
Oh,
level of
okay.
nursing is that?
Oh, okay. Well, you can a certified nursing assistant
Mm-hmm.
can come in, a LPN, which is a licensed practical nurse,
Okay.
can come in, and still a RN can. It just depends on the home health program that you choose. But a
Uh-huh.
certified nursing assistant, which teaches and provides all ADL care. You do have a licensed practical nurse. They mainly are medical nurses, but they can also provide ADL care. And of course,
Okay.
registered nurses, we train to do it all. We do medications, we do um, activities of daily living as well.
Oh, well, that's good. I am so glad you were here and shared all of your knowledge. Tell us if you have a final thought on anything you shared, something that you think is really important for an aging adult to know that we possibly have not discussed.
Mhm. I think we discussed everything, but I just want to encourage you guys to, even though you're older, continue to live your life. I'm still a rec therapy at heart. I feel
Yeah.
like when you're caring for yourself, and when I'm treating my patients, I look at them holistically. And one of the things I always ask my patients is, what do you do for fun? Because I feel like if you're enjoying life, then if you're enjoying life, you're gonna take care of yourself because you're not going to
Absolutely.
want to leave this world and no time soon. You want to take care of yourself. You want to have your independence as much. So that's one thing I tell my older adults. Get back into the things that you enjoy doing, or continue to do the things that you enjoy doing, even if it's just spending time with your grandkids, reading a good book,
Hmm.
gardening, doing those things. Continue to do those things because it gives you hope. It gives you something to look for, and it encourages you to continue to care for yourself properly.
I agree.
Yeah.
Having someone who has a rec therapy background will make it so that when you are doing whatever type of activity with them, that it is fun for you to do. So it doesn't feel like it's so much of a task to do. So
Right.
I definitely agree. Thank you so
Yeah.
much for being here. I hope each one of you who is watching has had an opportunity to learn something new, confirm something you know, challenge something you didn't know, and possibly give you an opportunity to share that information with someone else. Miss Ishman, have a good evening.